SUNY Downstate leadership, today's not possible without institutional support from the leadership. Dr. Lambert is a nationally recognized scholar and leader whose work advances health equity, public health research, scientific mentorship, and pathways for underrepresented researchers. He's helped lead major research training initiatives here at Downstate. He's focused on preparing the next generation of health equity scientists. This morning, he joins us on behalf of the SUNY Downstate senior leadership to officially welcome us to the campus. Please give a warm welcome to Dr. Lambert.
Good morning, everyone. Good morning. I want to start off by thanking Dr. Ukwu and Maven Community Health, Kavi, our community partners, and our students of Black Men in White Coats for putting on such an amazing event. My name again is Marcus Lambert. I have the pleasure of serving as the Associate Vice President for Research here at SUNY Downstate. And we largely think about building research capacity in my role. But really on behalf of our leadership, I want to welcome you all to SUNY Downstate, for those of you who are visiting, and welcome back for those who are students and faculty or staff. Just a little bit about SUNY Downstate for those who might not be familiar. We are a full-fledged academic medical center focusing on health education, research, and patient care for the city of Brooklyn and beyond. And that's a lot of people in Brooklyn. We're talking 2.7 million people. If Brooklyn was its own city outside of New York, the fourth largest city in the United States, just under Chicago. So we have a large patient population, a large responsibility in front of us. And we're home to the only medical school for Brooklyn, for all those 2.7 million residents, to get their training. We actually graduate more MDs than any other medical school in New York City. And over 60% of our student population, including our nurses and other trainees, identify as people of color, and the populations, the neighborhoods that we serve are even more diverse. So it's no surprise, it should come as no surprise that we are profoundly enthusiastic about hosting today's summit, especially one that focuses on health, and in particular, men's health and the health of men of color. If you take Black men, for example, a group that I self-identify as, we should be very concerned about Black men's health for a number of reasons. The US life expectancy in 2024 reached 79 years. But for Black Americans, that expectancy was only about 74 years. So there's a big difference there. And if you look at one of the leading causes of death, particularly for Black men, but for really a lot of people, it's heart disease. But Black men face heart disease, cardiovascular disease at higher rates than any other men in this country. 58% of non-Hispanic Black adults have hypertension, the highest among racial ethnic groups as reported by the CDC. And Black men and Black people in general experience higher rates of diagnosis and dying from cancers. So we know these numbers. If you're in this room, you're familiar with some of those numbers. But it's not all about the numbers, it's about real people. Fathers, husbands, children, sons, uncles. These are real people in our families who are facing some of these health challenges. And we want those fathers to be able to see their children grow up. We want those grandfathers to be able to see their grandchildren graduate. And far too often, we don't talk about sometimes the health of those particular men and those families. And what I want us to actually think about today is what it means to be strong as a man. Because strength is not necessarily about silence, it's about speaking out for those who are voiceless. Strength is not about ignoring your health, thinking that you can sort of push through, or really need to get checked, or I can handle this until it becomes unbearable. Strength is about advocating for your health and for your family. We were actually just having this conversation. You cannot take care of others until you can take care of yourself. I'll share a very personal story. My father, he's 83 years old, and he has his health challenges. You know, he's on certain medications and so forth, but he does a pretty good job of taking care of himself. He actually lives alone in Cincinnati. And a couple weeks ago, we had a little bit of a scare. He was at his sister's, my aunt's birthday party, and you know, had a few things to drink, but in combination with medication that doesn't always pan out in the right way. And he passed out at my aunt's house. Passed out twice. And so, first thing family did was call 911. Second thing they did was call me. So I told them, anything happens to my dad and I'm not there, you let me know. Put me on the phone. And so, 911 paramedics arrived. They took his blood pressure. It was 200 over 93. And so, at that point, he was, you know, coming back to himself. You know, fire department paramedics were there. I said, put me on the phone with him. So I said, Dad, how you feeling? He said, I'm all right. I said, I feel good. I said, well, you know, your blood pressure is really high. You know, the family's really concerned about you. We all think you should go to the hospital with the paramedics, ambulance, just to get checked out. Let's try to lower that blood pressure. And, you know, my dad, he's old school. He said, son, I'm all right. He said, I'm all right. I don't want to go. I said, you know, I pushed back a little bit. I said, Dad, just go, at least let them check you out, you know. You don't have to stay overnight if you don't want to, because I know he has hesitations about, you know, our healthcare system and so forth. I said, just let them check you out. Let's try to get that blood pressure down. Because that, you know, that can lead to a stroke and other things, complications. He said, I really don't want to go. He's like, I'm firm about that. He said, I'm gonna be all right. I just need to calm myself down. And so, you know, I think everybody was a little disappointed about that, but I know my dad, and I know, you know, how he was raised. This man's 83 years old. He's been through a lot, especially in the United States as a black man. And so, I just listened to him. You know, I listened to his concerns, one of which was he didn't want to disrupt the party and have everybody concerned about him, taking the attention away from his sister and so forth. And another thing he said, he's like, this is not the first time, which is true. It's not the first time that it's happened. And so, you know, it made me reflect a little bit about this notion of strength, right? This concept of, you know, sometimes as a man, you gotta push through, you gotta be strong, you know, I can handle this, I can, you know, do all the things that's necessary. But it also made me sort of meet him where he was, right? To listen. And sometimes we have to listen with our family members, with our patients, with our colleagues, and understand their concerns so we can meet them where they are. I said, so Dad, you know, I was like, if you're not gonna go to the hospital, at least call your primary care doctor. Let them know what's going on. Let somebody stay with you tonight, so, you know, if anything happens, you know, you're good. So he agreed to those things, and he ended up being fine the next couple of days. We called, you know, the blood pressure got lowered and everything. So it just taught me this lesson that you really have to meet people where they are, but also this notion of strength in our community. And that's what I want us to kind of think about, that strength is not necessarily ignoring your health. Strength is really protecting your future. And what steps are you taking? What steps are you propagating to really leave other people with that message? So there's three things that I really want to leave you all with today. The first of which is in this day, in this event, learn something that can either save your life or save the life of someone else. Even if that's just, you know, calling 911, but try to learn something today that you will walk away with. Second thing is do something concrete within the next month. You know, in terms of Maybe you schedule that doctor's appointment, maybe get that colonoscopy that you've been putting off. Maybe you tell your family member, your dad, your uncle, about something that you learned here today, but do something concrete. Walk away with a take-home goal. And the third thing is, if you can bring someone else along to the next event, or bring someone else along in terms of knowledge or patient care, let's make a commitment to do that as well. So I hope today is about not just awareness, but about action, and thinking about what it means to be strong in terms of health. I want to leave you with a final message, Nixon 5.